Well, good morning, everybody. Thank you for joining us. I'd like to welcome you all to the second part of our three-part 2026 Volunteer Engagement Leadership Series. My name is John Palmer, and I'm the Volunteer Services Director here with Volunteer Florida. For those of you who may be unfamiliar with this department, the Volunteer Services Department seeks to strengthen Florida's communities by promoting volunteerism as a solution to critical community-wide needs in Florida. The department establishes initiatives like Suits for Session to encourage Floridians to serve, and supports the efforts of public and private nonprofit organizations to recruit and mobilize Floridians as volunteers. Today is a part of that mission, and the Volunteer Engagement Leadership Series serves to connect experts in the field with you all to provide tools and insight to better further your own mission. A little housekeeping for today: please keep your cameras off, and microphones muted unless prompted. And today's recording, along with the other two parts of our series, will be made available to you all on our website after the conclusion of our third and final part of the series next week. Thank you all again for attending. And with that, I will pass the microphone over to Miss Beth Steinhorn.
Good morning, everyone. Thanks so much for joining. Please keep the info coming in the chat. I love seeing where everyone's joining in from. Quite the variety across the state of Florida. Looks like we've got some from outside Florida, including Puerto Rico. So welcome. And I'm Beth Steinhorn. I'm president of VQ Volunteer Strategies, and I'm a consultant. I work with volunteer strategy with organizations across North America and have been a longtime partner with Volunteer Florida around, among other things, its Service Enterprise Initiative, for whom I serve as the trainer and coach to help accredit organizations across your state as service enterprises, which I'm happy to talk about another time or at the end of today if we have some time. But I'm tuning in today from my office in Denver, Colorado, and am thrilled to be joining you virtually, particularly around this topic. This is a topic that many of you may already be encountering or will be very soon, namely how to engage volunteers who are required to serve. This includes individuals completing court-ordered community service, school requirements, workforce or rehabilitation programs, and increasingly those who are seeking to maintain public benefits like SNAP or Medicaid. So the idea of engaging required volunteers, or as we sometimes refer to them, VoluntTOLDs, isn't new, but it is evolving. So why does this matter? If it isn't new, why does it matter, especially now? We've always had some level of required service in our sector, but we are anticipating a significant increase due to policy shifts, including changes tied to House Resolution 1 that expand work and service requirements for certain public benefits. That means many more individuals will be looking for opportunities and more organizations will be asked to respond. The key question may feel like it's, should we take them or not? But I believe the real question we should be asking is, how do we make intentional, strategic decisions about if and how we engage volunteers who are required to do service? So I want to ground this idea in some shared experience. Number of years ago, I was called in or I appeared for required service. My day went like this. I arrived 25 minutes early and checked in. This was at 8:05 in the morning. At 8:35, the person in charge welcomed me along with about 140 other volunteers, showed us an orientation video, which was really informative, helpful, inspiring, answered every question I have. By 8:50, we were asked to just wait until we were given our assignment. A few other things happened, but by 10:45, I was thanked for coming in and told that I wouldn't really be needed and I was free to go. And I left feeling like I had done my job and wasn't at all upset. Why? Because, of course, this wasn't this may not have been an area that we often think about as voluntold, but basically, you may have guessed, I had been called in for jury duty, right? Jury duty is something I didn't sign up for of my own volition. I received it as a jury summons, and And while there may be a lot of baggage around it, I was happy to serve, and yes, relieved that I was ultimately released after a few hours of sitting there. This is the mindset that, I mean, granted, I would have been happy as well, most likely to have served. Um, but the point was, I was treated respectfully. I was valued for my time. I was oriented. And it's a great example of how we can be thinking about required service. It's very helpful to think about the fact that required service, voluntold, it's not new, but we have to remember that for most individuals who are required to serve, they didn't necessarily choose this experience. Though with House Resolution 1, which I'll talk about, they do have a choice. And this is something that folks are opting in as opposed to working or school to try to figure out how to fulfill their requirements. They didn't choose the requirements, but to fulfill it through volunteering. Our job is to decide, do we want to engage them? And if so, how do we design an experience that works for them and for us? I have examples well beyond jury duty, much more around more what we would, consider in your world affecting your organization, whether it's a municipality or other local government or a nonprofit organization. How can we transform this potential pool of volunteers into a truly strategic asset on behalf of our organization? And before I dive into that and some of the other stories, I want to understand a little bit about what brought you here today. And maybe you could just put in the chat um, A, B, C, or D. Are you here predominantly because you're interested in engaging more required service volunteers? B, you're interested in refining current practices for required service volunteers. C, you were just curious. Maybe you signed up for the series and you just figured, well, I'll take this one. I don't know what that's about. Or you don't know, which is also okay. A little bit of A and a little bit of B. You're, oh, great. Okay, we got some B's and C's. So people are being brought here for a variety of different reasons. Haven't seen any D's yet. Glad most of you showed up with an idea of what brought you here. Um, but I think that what I'm seeing in the chat, kind of an equal smattering of A, B's, and C's. Many people are curious about this, um, and many are interested in starting or refining practices around engaging more voluntold, I'll call it. So let me share a little bit more about why, after all these years, and I've been working in this field for a number of decades, why this year we felt we really need to develop a workshop and some tools around this. And it really had to do with a major shift in federal policy, specifically House Resolution 1, the bill that was passed by Congress in summer 2025. This legislation introduces new requirements tied to both SNAP, Supplemental Nutrition Program, and Medicaid benefits. Here's what's important for you to understand. Many adults are now required to work, participate in job training, attend school, or complete community service for at least 80 hours per month in order to maintain benefits. For SNAP, those rules began in November of last year and expand the age range for required participation up to age 64. And for Medicaid, requirements officially begin January 1st of 2027, although states can implement them earlier. So what does this mean for you? Because I'm not giving a legal analysis. I'm not an attorney. I don't provide legal advice, though I see we have some attorneys or those who work with legal aid on the call. Thank you for being here. But what does it mean for you? It's not a small shift. This is a structural change. More people will be looking for qualifying service opportunities, needing documentation and consistency, participating, yes, because they have to, not necessarily because they chose to. So again, the question I think we all need to grapple with is not just do we take these volunteers, but how do we respond in a way that is strategic, ethical, and sustainable? And the great news is we have examples of organizations that have been doing this well, thoughtfully, strategically for years that we can look to that predate the House Resolution 1. And one of them is in your neck of the woods, Every Pet, which was formerly known as First Coast No More Homeless Pets. It's based in Jacksonville, Florida. And I had the great honor to work with them through Volunteer Florida as one of our now accredited service enterprises. Again, this is a national accreditation that recognizes excellence in volunteer engagement. And one of the amazing things about Every Pet, which offers affordable quality vet care for all, is that the majority of their volunteers are uh, are community service volunteers. They have a couple hundred volunteers, most of whom are community service volunteers. This is not a typical shelter. This is a network of veterinary hospitals that provide low cost or free vet care. So they do have some animals sheltering there while they're recovering, but it's not your typical need for lots and lots of dog walkers and adoption volunteers. This is more of a veterinary medical facility. And many of their volunteers, most of them are either through court-ordered community service or workforce development through an agency rehabilitation program. What does Brian, who is their volunteer coordinator, how does he engage, he and his colleagues, how does he engage these volunteers? Court-ordered community service volunteers help with laundry. And if we have any people working in the animal welfare, animal care, rescue world here, you know there is just endless amounts of laundry when you're working with animals or a veterinary hospital. They help with janitorial services. They help with maintenance. Vital volunteer roles that take a lot of time, and they benefit from having, um, unlike sort of more traditional volunteers who may want to show up for 4 hours a day every, 4 hours every Tuesday. Court-ordered community service volunteers may have 20, 40, 80 hours that they need to complete, maybe even more, 150 hours, and they'll come multiple hours over the course of many days a week. So they are regular, reliable, and are there to help move through these projects. Workforce development volunteers or workforce rehab volunteers are often individuals who have positions. Some of those we met were like electricians and others who, due to work-related injuries, are unable to. They're on workers' compensation. They're on leave from work due to physical, uh, um, you know, injuries that they're recovering from, and their company will pay them to do work in the community while they are on rehab leave. And Brian has connected with these rehab agencies and places volunteers, especially in data input and phone banks, because those are great, not physically taxing roles that these volunteers can even do from home. So when I asked Brian what are some of his, what are some of their processes and what is some of his advice for court-ordered community service, I think it's really important to recognize that they have thought long and hard about what are the right practices to have in place. Of course, they conduct background checks and have take each one on a case-by-case basis. Anyone who has a violent crime, and certainly any offenses that involve animals, are not accepted, but other offenses absolutely are, and they take them on a case by case. They review each one thoroughly, and they identify specific areas of no-go, kind of uh, milestones or forks in the road, and they meet with each person face to face. They have a zero tolerance policy, but that doesn't just apply to court-ordered community service, it applies to all volunteers. And they really do think outside the box to find the right role. Once a prospective court-ordered community service volunteer is accepted, no one in the organization except for Brian and his boss know who's court-ordered versus others. They are part of the volunteer community and treated as such. Um, For their rehabilitation volunteers, they work closely with community employers. They specifically find roles that don't take much physical activity. And in fact, it's because of that partnership that they began thinking about we could have more volunteers on our phone bank. We could have more volunteers doing some of our data entry. And they're able to rotate roles as needed. His advice is really give it a chance and come up with a thoughtful strategy. And again, the majority of their volunteers by far fall into these required service uh, categories. I'm going to share one other story, then I'm going to kind of share, then we're going to dive into how you could have a thoughtful and strategic approach. I see a question from Stephanie. Yes, the question is about getting a copy of the slides. John is going to be making the slides available to all the registrants through the website or through a follow-up email. And you should see as well at the start of the chat, and I'll repost it before breakouts. I also have a handout that I've made downloadable from the chat that we'll be walking through together as well. So here's another story. I work with a community center, Mosholu Montefiore Community Center in the Bronx, New York. Their mission is to improve the lives of Bronx and Manhattan residents through humanitarian efforts, gateways to success and quality programs and service. And Milani Plaza is their volunteer coordinator. She is a magician, just an amazing force when it comes to partnerships, particularly around school uh, community service. She has partnerships with local universities and local high schools, and a very large percentage, I want to say again, more than half of the volunteers, in fact, it might even be 75% of the volunteers who serve at MMCC are from universities or high school students. The high school students often come not just from high-level private schools, but also schools for at-risk teens. They create an internship environment, which means she's not just thinking about what they can do for MMCC, but how she can make these experiences enriching for the high school students so they get work experience. She trains them a little bit in work appropriate attire, work appropriate behavior. Um, and she has volunteers, teens, and students helping as tech buddies to some of their seniors, helping seniors who come to their senior day center with understanding how to use their phones, do FaceTime, things like that, and a number of other roles, including food pantry. The other piece that I find fascinating is her partnerships with universities. She has robust partnerships with local medical and nursing schools. Um, and she creates opportunities for these students to learn about the communities whom they will eventually be serving medically. So she has volunteers coming in doing blood pressure monitoring, educating older adults on health. And again, through partnerships with the Albert Einstein School of Medicine, a local nursing school. She has a constant pipeline of volunteers coming to help in those arenas. The key, obviously, is partnerships. The key for students is creating partnerships. When I asked her advice, she said partnerships, partnerships, partnerships. She has formal memoranda of understanding with universities, though with high schools, it's a little less um, formal. And Milani's advice really was this: don't wait to be invited. Show up at their events, network, and offer opportunities to them and build partnerships around that. This is an incredible workforce development opportunity for high school and college. She does talk about the time that it takes. It's important to be relatable and personable to the volunteers. And I would add, if you aren't full-time or if you already have multiple hats you need to wear, you could also engage a volunteer to be that key link for student volunteers. And she did say food and treats are always good, especially for the high schoolers, and ensure that you demonstrate appreciation. So I always like to start with those the couple stories to give you a sense of what's working for people. But now I want to walk through what really is a pathway that's going to help you get from wherever you are in your practice to a thoughtful, educated decision about where to go from here. And in fact, what we're going to be talking about after I define terms is how can you assess your readiness and capacity to engage required volunteers, and what communication strategies can you leverage in order to make the case to leadership? And that could be to make the case not to engage more community service volunteers. It depends on how your assessment goes. I have a number of clients that have come to me in the last few months saying, my leadership says we need to be able to engage an additional 150 volunteers because of House Resolution 1 and these work requirements and volunteer requirements. And we only have 120 volunteers. How can I double or triple my volunteer corps every month? I don't have capacity to do that. So I'm hopeful that what we're going to be sharing today will help you make the case after going through a thoughtful assessment of what can work for your organization and to make that case effectively. As I mentioned, there is a handout and it should be downloadable from the chat. And if it's not, if you're not seeing it, then someone can tell me in the chat and I'll repost it. But this is what it's going to look like. And the first couple pages walk us through 7 steps of assessing readiness, which I'll be doing through our slides. So don't worry if I'm scrolling quickly. And then the second half of this, I hope I'm not making you dizzy, is how do you make the case? A practical guide for conversations with leadership and staff. So you are going to have this takeaway and also as a discussion guide when we break into breakout rooms. So that's our agenda. Let's see where we can go from here. I'd like to start by defining terms. What are different types of mandated service? Not all required volunteers are the same. There's a big difference between a high school student completing 20 hours. Someone's not seeing the link in the chat. So let me just repost it super quickly. Should be there again now. So there's a big difference between a high school student completing 20 hours, someone completing court-ordered community service, that could be well over 100 hours, someone trying to maintain access to healthcare benefits, and yet each person brings different motivations, different constraints, and risks and opportunities. So what are different categories? There's court-ordered community service, individuals mandated by a court to complete service hours, usually in exchange or in addition to um, uh, jail time or other penalties. School-based community service requirements, those who are completing required service for coursework or for graduation. There's internships or service learning. Often these are structured, supervised roles tied to career or academic development. There's workforce readiness or rehabilitation, who are rebuilding skills or building skills for employment. And finally, then there's the public benefits requirements, those who are completing service to maintain eligibility under federal or state policies. So just to get our terms straight, and I'd love to know if any of you can just put it in the chat, are already engaging some of these categories. My guess is many of you are probably already doing school requirements. That's one of the most common, but maybe we can just see a smattering of those of you who are already engaging some. Love to know where you are in terms of engaging some of these groups as I kind of move forward. Too often, organizations respond to required, oh, thanks, Neil, school and workforce readiness. Love that. So too often, organizations respond to required volunteers reactively. Yes, we'll take them, or no way, we're not going to do that. Both of these are decisions, whether they feel like it, whether they feel like decisions or not. And what I really want to do is move from reactive to strategic to proactive. That's where that planning and readiness tool, that first couple pages of that handout come in. We've designed this tool to help you think through, does engaging required volunteers make sense? If so, what conditions are needed to be in place? And then we'll walk through these steps together. So, 7 steps. First step, clarify the who. As I mentioned, not all required volunteers are the same. So who are you already engaging? And whom might you engage in the future? Is this exercise because leadership has said, or you have said, we want to engage more benefits related service volunteers? That's a service we can provide to our community. Do you want to develop more workforce development opportunities or internship, school, community service hours? Think about the who. And if they fall into more than one of these buckets, you might need to go through the exercise more than once because many of the characteristics of each group, while every individual is unique, the characteristics may vary in terms of how much time they're available to provide, et cetera. So first is, who are we talking about? Next is more of an internal look. This is where many organizations, I think, go wrong. They start with, we have people, where can we put them? Instead of, what do we actually need? And how could volunteers support that? We want to think about existing gaps in our services, in our capacity that volunteers might be able to help address, as well as new opportunities, intentionally designed roles. The key message here is this is about designing experiences that benefit both your organization and the volunteer, not just placement. Um, so what roles or functions might you as your organization need that could be addressed through engaging community service volunteers, just like um, the example from Every Pet, where they realized that rehabilitation volunteers could be engaged with remote phone work, which was not a volunteer role they had had before. So, what are possible new roles or gaps that could be addressed by required volunteers? At the same time, what existing roles could be redesigned to be addressed by or to be filled and tapped this by tapping into this pool of volunteers. So, step 1, define the who. Step 2, assess your needs. Step 3, recognize you're not starting from scratch. Where do you have assets from which you can build? Think about existing partnerships. Whenever I think about partnerships, I think about MMCC, the Bronx-based organization I shared earlier. I started working with MMCC long before Milani was hired as their volunteer coordinator, when they were just building out a formal volunteer program in 2020, 2021. And it has been so inspiring to me to see what Milani has done in formalizing, just in the last few years, these partnerships with schools, with local agencies. I think about Brian and his in Jacksonville, his relationships with the courts. He has personal relationships with probation officers and a whole network of probation officers because they are often the ones who are recommending places for court-ordered community service volunteers to serve. And many of their court-ordered community service volunteers opt to stay on after they have fulfilled their requirements, which to me acknowledges the importance of really welcoming them into the community, regardless of the pathway that they took there, because they have chosen to remain a part of the Every Pet community and share their time ongoingly. So think about your partnerships. Think about your champions or skeptics. Who are the people that are your assets in your organization, and where might you, I don't want to say avoid, but let's not start with the hardest place. Maybe there's a department where they're more open to piloting this type of program. Start with them rather than starting with your skeptical side. And then also think about your community infrastructure. What agencies and organizations do you have in the area that you can tap into? So again, what are the strengths? What are the assets you can build from? Step four, this is where we need to slow down. We should be considering ethics. Are we offering meaningful experiences or just filling slots? I'm going to also talk about risk management and capacity, but I want to start just talking about ethics a little bit. We don't often, though we should, talk about ethics in volunteer engagement. Um, Volunteer engagement is a profession, and as such, we have sets of professional standards as well as professional ethics, which are essentially a set of standards by which we evaluate one another, organizations, everyday occurrences, and it's important to acknowledge, do we have any ethical dilemmas in inviting volunteers in, required volunteers in to serve? Um, an ethical dilemma is simply when there is a conflict of interest between two or more ethical interests. And I remember years ago when this type of required service to maintain SNAP and Medicaid benefits was being considered. About 10 years ago, I was working with a different state, and one of the big concerns at the time was if you are, let's say, a low cost medical service organization. Maybe you provide free or low cost dental services or medical care or mental health services. And there are clients, patients who need to maintain their benefits in order to receive your services at your organization. Is it ethical to engage them as volunteers so that they can fulfill their 80 hours a month by volunteering in order to have their benefits to get their mental health benefits or their root canal or whatever it is that they need? I'm not going to tell you whether that's ethical or not, or what role is appropriate, but I want to just unpack that some of these decisions are not cut and dry. And there are tools in our field to help think through the ethics. Tools through the certification in volunteer administration, our CCVA, the Council for Certification in Volunteer Administration, offers tools and resources on professional ethics. How do we weigh citizenship, respect, accountability, fairness, trust, these values and ethics related to our field in order to make appropriate decisions and be able to defend them as we move forward? So ethics is a key piece to think about. Beyond ethics, we also want to look at risk. This is, again, where we need to slow down for a moment. And I want to be really clear that assessing risk isn't about lowering standards because service is required. We should apply the same rigor that we would to any volunteer role. And again, I direct you to resources from the Council for Certification in Volunteer Administration, um, and acknowledge that managing risk is a way to actually open up new opportunities. I think about an organization whom I just recommended for accreditation as a service enterprise. They're waiting to hear the final decision, but a large organization based in Texas that helps families and foster children. Um, and they actually embarked on elevating volunteer engagement and thinking about volunteer engagement as a strategy because of an initiative where they were focused on assessing and mitigating risk. And they realized that they can do what they do without volunteers. And so let's make the volunteer engagement lead a director role, bringing that up to the C-suite or to the director level. Let's acknowledge that not we're going to mitigate risk, so we're not going to engage more volunteers. Rather, we're going to do so strategically and thoughtfully and engage volunteers within our overarching risk management plan, and we're going to be able to build our capacity as a result. So managing risk isn't just about contracting or restricting. It can be about thoughtful and strategic ways to engage even more volunteers in roles that are appropriate. So risk is another thing to think about. Of course, as we saw, it doesn't mean accepting every offer of assistance. Brian at Every Pet doesn't accept any court-ordered community service volunteers if their offenses had to do with were violent or had to do with animals. That certainly makes sense not to include them in their arena, but there are plenty of other opportunities where individuals have many skills and low risk and are able to serve in their community. The last consideration is capacity. This is often the one that is most limiting. Not risk, not even ethics, it's capacity. Is there staff time to engage and support more volunteers? Court-ordered community service, student volunteers, rehab volunteers, or any volunteers? Is there time for staff to create these roles, provide training, provide support and supervision? And are there systems to support it as well? Oh, Stephanie, this is your biggest struggle, capacity. I'd love for you to share a little more. Do you have more? Right. It takes, people think that bringing on more volunteers because volunteers give their time freely, that this is a free opportunity. And yet it's not free to engage them. Yep. It's not free to engage volunteers. It takes an investment. Your time, it takes technology, it takes fees for background checks, it takes training support. It is not free to engage this resource. It is a strategy that takes an investment. And that is why it's helpful to think about and articulate the capacity limitations. So in a few moments, we're going to be breaking into small breakout groups, and you're going to have a discussion about a couple of the early steps, not all of them, but let's get over the hump. We've gone through steps 1 through 4. Let's get to step 5, which is policy and practice. I'm not going to walk through all of these details, but the gist of this is consistency matters, and we need to think about, especially if you're thinking about dramatically expanding a program rather than just engaging 1 or 2 required service volunteers as like a pilot. We need to have clarity around our systems and our policies for screening, placement, training, and supervision. What do you have in place? And where are your gaps? Because if you have gaps, engaging required volunteers is simply going to amplify those gaps. So we need to make sure we have the right systems in place before we look to expand it. Number 6, my favorite word, pilot. Let's scale this in a sustainable, incremental way. You don't have to decide everything today. Start small. Call it a pilot, which allows you to test assumptions, learn what works, adjust before scaling, and build support. Stephanie, I see that your comment is that getting buy-in is tough and getting staff to think beyond the roles that have been established is a struggle. My recommendation, and I don't want to oversimplify this because I don't know all the details of your organization, but my suggestion is call it a pilot, make it appealing for some staff members, maybe just 1 or 2 in different departments to opt in, those who get excited about change and innovation, and maybe incentivize it in some way, if nothing else through recognition, if not through additional support, um, financial or otherwise, and pilot a couple new roles, 2 new roles and ways to engage required service volunteers, and say you're going to give it 6 months or a year and then assess and build from there. That's one of the most powerful ways to build buy-in. So again, we've talked about identifying the who, thinking about your needs, looking at your assets, giving key considerations to things like ethics, capacity, risk, and assessing your processes, making sure you have all your ducks in a row and infrastructure, and then you can really reflect and decide, are we ready to engage required volunteers well, not just quickly? And what needs to be true before we proceed? What needs to be in place in order for us to proceed? So you are not going to be able to answer all of these questions today, but we're going to take about 10 minutes and go into breakout rooms. This is going to be the first of two breakout rooms. Please don't all leave once we start breakout rooms. We're going to come back in 10 minutes. Often people drop off, but I have a whole second half of it for us to talk through. Um, and I'd love for you to, in these small breakout rooms, just share what's coming to your mind in terms of whom you're considering engaging? What assets do you have? And is there something else that you want to be considering as part of this assessment? We're not going to be talking about making the case yet. We'll be doing that after we come back. But basically, who might you engage and what can you already build on in your organization? And then we'll come back. We'll do a very short share out, mostly through the chat, and then we'll talk about, with that decision in mind, how are we going to then communicate this and build the case? I do understand some of you may need to leave, but you'll have the recording and the slides to tap into as well. So with that, I'm going to stop sharing. And it looks like we have maybe enough, John, for 5 or 6 breakout rooms. You're going to be assigned to a breakout room. You're going to be there for about 10 minutes. I'll visit, I'll send the questions, I'll post the questions, and we'll come back and do a quick debrief and keep moving forward. So hopefully the breakout rooms are launching. There you go. Your breakout rooms are launching. You should be able to accept the breakout room. And John, you might pause the recording right now, just so 25 more seconds left. And then everyone will be sent back. So let's see. And I wasn't able to get to every single room, but I got to a number of them, and I enjoyed hearing some of the interesting challenges. We're not going to do a full go around the room. We have too many people for that anyway. But if there was an aha moment or a great idea that came from your breakout, feel free to share it in the chat. Love to hear the different discussions and get everyone to learn from that. But in the meantime, what I hope, what I heard in the 5 groups I did visit were interesting ideas about how you're currently engaging required volunteers, interesting discussion about board members and how to get them further engaged. And ultimately, what I hope you've done is begun the process of kind of completing the hard part, assessing readiness, and ultimately, and once you go through the handout on your own or with colleagues, made a decision about whether or how to engage required service volunteers. Now comes the part that determines whether anything actually happens, communicating that decision in a way that others understand, support, and act on. We really shift from, can we do this, to instead, what should we do and how can we communicate that clearly? This is where many volunteer leaders get stuck, not in the decision, but as Stephanie mentioned early on, in making the case internally. So, my first message about this process is that we need to embrace our roles as leaders. We're not just leaders of volunteers, we're leaders of strategies. Whether your title is volunteer coordinator, director of volunteer engagement, community engagement, maybe you're a fund development officer, maybe you're the CEO. But regardless, anyone who leads volunteers is leading a strategy of engagement. And your role is to influence. That means being clear about our recommendation, connecting it to what matters organizationally, and anticipating concerns before they're raised. So that starts with crafting a recommendation. If you take nothing else from this section, take this. If your recommendation isn't clear in 1 to 2 sentences, it won't land. This is not, we've been thinking about required volunteers. This is, we recommend piloting engagement with X group of required volunteers over X time frame. Clarity builds confidence. So you don't need a long explanation, just a few clear, strong points. Why does this matter now? How does this align with our mission or our priorities? What will it require? And what would success look like? Excuse me. Looks like a sneeze. Key message is this is about being focused, not about being exhaustive. So again, key points are why does this matter now? How does it relate to our mission? What will it require? And what will success look like? When we think about communicating and influencing people, another key piece is to anticipate pushback. If we don't name concerns, others are going to. And often they'll assume you haven't thought about them. So strong communication often includes naming those likely concerns, showing how you've thought of them. That's a way to build your credibility. So I would love to just hear through the chat, what are some of the pushback that you anticipate or have experienced already at your organization? Put it in the chat because I've definitely seen just from the comments already that that getting buy-in is difficult. So I'm going to give folks maybe a chance to just share briefly in the chat. What pushback would you anticipate if you were to propose expanding your required service strategy? Hopefully someone's typing. Um, and sometimes pushback can come. Oh, good. Here's one already. Let's see. Much of the time, they don't commit long term. Volunteers might not commit, required service volunteers might not commit long term. That's true. And that is actually probably, in my experience, most true with student volunteers, even more so than community service volunteers who often have a good chunk of hours. But here's the thing that I would say all volunteers today are volunteerism in general has shifted to more short-term, flexible, and episodic. So required service volunteers in that regard are not any different than general volunteers who are increasingly interested in short-term and flexible opportunities. In fact, as per my case studies that we opened with, in those cases, required service volunteers tend to be the most reliable. Let's see. Neil says this isn't much of a concern for us. Both Neil and the CEO are on the same page and always looking for better ways to engage volunteers. So you do have a problem with long-term commitment. And long-term commitment, again, is not unique to court-ordered or community service or rehab volunteers. Most volunteers today are interested in shorter term flexible opportunities. So let's not scapegoat that issue just onto required service volunteers. It's true of everyone. So as we recognize that and think about how do we sustain relationships rather than retain volunteers in the same position year over year, which is how it was when I started in this field 30 years ago, handing out lots of more than 30 years ago, handing out lots of 20-year and 30-year pins. Most organizations are not handing out 20-year and 30-year pins. Most organizations are happy to have a sustainable pool of volunteers who come in and out of service with them. And I believe if appropriate, if ethical, if we can manage the risk and if we have capacity, engaging required service volunteers can help be part of that sustainable pool. In other words, it's not just required service volunteers. So anticipate pushback. Next, recognize that you're not just presenting, you're facilitating a decision. So ask questions. Um, think about ways that you can facilitate a discussion that helps leadership clarify priorities. Perhaps tie this work into a new strategic plan or an existing strategic plan. Facilitate the opportunity to surface concerns and engage in the decision together. So in the handout, you'll see that part 2 is a chance to walk through, once you've made a decision, to walk through your core message, some supporting strategic messages like why now? That's the urgency piece is really key. Why does this matter now? How does it align with our mission? What will this require? And again, what would success look like? This is going to help us achieve our mission by. This is going to help us sustain a pipeline of volunteers. This is going to help us achieve our workforce development goals, not just for our regular clients, but for the volunteers who are involved with us. Whatever those priorities are, it gives you a place to anticipate questions and even resistance and ways to guide the conversation. So once again, we are going to just briefly go into breakout rooms and have a conversation about what you would likely recommend and whom do you need to influence. Those are the key pieces. Whom do you need to influence in order to recommend going forth and engaging more required service volunteers or not? Because sometimes the influence is unless we get 2 more staff members or unless we improve our technology so that we can accurately track hours and community service to be able to document on behalf of the required service volunteers, we don't have capacity to engage more. So what are you going to recommend? Yay or nay? And if it's a yay, who? And then whom do you need to bring into this conversation? If you have time, you can also talk about what would be your key message. But what I really want to start with, what would be your decision just based on an initial thought process, and whom do you need to influence? And we're going to take just another 8 to 10 minutes. It's going to kind of be a speed round in our breakout rooms. And then we're going to come back together and have a solid 10 minutes at least for questions for me or for others as well. So again, we're going to go to breakouts briefly, come back together, and then there'll be time for you to ask questions and have a discussion as a whole group as well. So John is going to launch the breakouts. Everyone's back. Yes, great. Well, welcome back. And thank you. I know I popped in quite a few of the rooms, so I want to make sure and heard some interesting different conversations going on. I just want to share a couple closing thoughts of mine and then really open it up for a discussion as a group. The key things I'd love for each of you to take with you are, first of all, that hopefully it's not a surprise. Engaging required volunteers is not just an operational decision, it's a strategic decision. We should intentionally assess whether and how required volunteers align with your mission, your capacity, and your goals, rather than responding reactively to requests or to policy changes. This is about being proactive and thoughtful, not reactive. And remember that not all required volunteers are the same. Different populations require different approaches. Court-ordered volunteers, students completing service requirements, workforce readiness participants, individuals maintaining benefits through federal programs like SNAP or Medicaid may all have different motivations. They may have different constraints. They may have different support needs and risk considerations. And I'll add that so do all other populations of volunteers. So this doesn't make them unique in the grand scheme of volunteer engagement. It makes them unique um, just in regard to other populations of volunteers. And readiness matters. Successful engagement depends on organizational preparedness, whether that's clear roles and expectations, staff readiness and buy-in, appropriate screening and supervision, and capacity policies and systems that support meaningful engagement. Fourthly, we need to think about the design of the experience. Ethical and effective engagement requires that. Required service should still be meaningful. We're not looking, I don't recommend creating busy work for required service volunteers. Their work should be mission aligned, it should be respectful, and aligned with organizational values as well. It's not just about placing people, but rather creating experiences that support mission impact and the dignity of our participants. And finally, you as leaders play a critical role in guiding organizational decision making and communication. Leaders of volunteers, you all, regardless of your title, are uniquely positioned to assess opportunities and risks, to build informed recommendations, to communicate strategically with leadership and staff, and to help organizations respond uh, proactively to evolving community and policy realities. So those things are all important to keep in mind. And I'd love to open it up for questions or aha moments that you have before we kind of take this home. We have about 10 minutes to do that. So questions or aha moments that any of you have had come to mind as you have gone in breakout rooms or have thought about this ongoingly. Any questions, comments, thoughts that you want to share before we wrap up? We'll give it a little bit of a good wait time, but feel free to also unmute. You don't have to just type. We're a small enough group now. If you want to unmute and share thoughts, love the embrace your role theme. Oh, Maxine, that's great to hear. I think that's really important. You are leaders, not just leaders of volunteers. You are leaders, and we often get relegated to being a fulfillment center. And leaders of volunteers are not a fulfillment center that simply produces, you know, matching fluffy yellow volunteers or whatever it is over a period of time, like some Dr. Seuss machine. This is about leading a strategy that's going to build your organization's capacity. So I'm glad that spoke to you, Maxine. Go forth and embrace that mantle of leadership. Other thoughts or questions? We got you all talked out. Brooke says, I think shifting the mindset from always trying to retain is something I need to impart to our leadership team. I love that, Brooke. Let me just share. I won't jump on the soapbox too long, but let me just share. There is no sector-wide industry standard definition of retention. There is not a professional standard or definition of retention. In fact, a number of years ago, we were hired to do research on retention. And not only is there no industry standard, there's no academic standard. You are empowered to define what retention is. Now, obviously, needs to be logical and rational, but retention could be keeping the same volunteer in the same role year over year. That's kind of an older definition. It could also be, and many organizations say, we have 100% retention if the volunteers who signed up for this 6-month position, this 1-year commitment, this summer opportunity, fulfilled the requirement for which they signed up. Getting return volunteers is another data point. How can we convert people to repeat volunteers? But retention could be simply fulfilling the commitment that they made. It could be, if you work in the disaster arena, retention could be simply ensuring that volunteers stay appropriately trained and certified in order to be able to be deployed or called out to serve in response to disasters. So there are lots of different definitions. And one of those that I think is really important, or that mindset, that helps us shift beyond being measured for success of keeping volunteers year over year is more about sustaining relationships with them. How do we sustain relationships with people, recognizing that during this season of their life or this season of the year, they may be actively volunteering, whereas in a different season, they may be a good advocate or donor for us, but aren't able to actively volunteer. Yet they're opening our emails, they're making an occasional donation, they might be recruiting another volunteer on our behalf. People are multifaceted. They don't fit into just one slot in our universe of our organization. How can we sustain a relationship with them? So, Brooke, I would love for you to find out what data points can you pull about how many volunteers are donors? How many volunteers are also getting your regular organizational newsletter? How are they manifesting their relationship to your mission? And recognize that volunteering is only one way to do that. Well, thank you. I'll hop off that soapbox now. Anyone else have questions or comments? I have lots of soapboxes, so I'm happy to hop on any others. Well, as folks, excuse me, as folks are perhaps getting up the nerve to raise their hand or typing out a last comment or two, I will just share a few parting thoughts and resources. Feel free to link into me or reach out through our website if you have additional questions. Our website has lots and lots of free resources. We have an active blog. We have a newsletter that only comes out roughly three, four at most times a year. And also, we've got a whole resource center on our website now with books, toolkits, blog posts, lots of templates like the ones that I just shared via in the chat. So feel free to come to our website and visit our resource center. You can search by topic, etc. And Volunteer Florida has lots of resources as well. So, John, we have a couple minutes. If you want to share any information about Volunteer Florida resources, happy to have you do that before I take us home.
Yeah, thank you so much. Yeah, absolutely. We have a number of resources. Namely, the one that comes to mind directly related to today's topic is Volunteer Connect. If you're not already a part of Volunteer Connect, please feel free to sign up. It is a free opportunity for you to promote your volunteer opportunities and to directly tie it to this topic. You can actually select for your opportunities if you are able to accept court-ordered or mandated VoluntTOLDs. So that is an option for those volunteer opportunities. So feel free to utilize that program however you wish. And then the other one of our other resources as well. We have our past volunteer engagement leadership series recordings on our website as well. So feel free to check those out on our website. And um, and yeah, we're having a number of trainings on there
Yeah.
to you all as well at no cost. So happy to help you navigate that. If you have any questions about our website on that, well, go ahead and hand that back to Beth.
Great. And the code led to a 404 page not found. All right. Well, that's interesting. Thank you. If you just go to our website, vqstrategies.com, you will be able to then click on resources and go to newsletters. That's interesting. I'll check that out. Thank you, Maxine. In the meantime, I hope that you will use the handout and this information to guide conversations and a thoughtful assessment of your organization's readiness and opportunities to engage volunteers who are required to serve and do so in a thoughtful, intentional, and capacity building way. So thanks so much and best of luck to you.